HIV in the White House. That's what we're talking about today on Plus Talk, where we're all about turning positive into a plus. Joining me is Francisco Ruiz. He is the director of the White House's Office of National AIDS Policy. Nice to see you, Francisco.
Thanks for having me.
What is the White House's Office of National AIDS Policy, or is it sometimes called ONAP, and what happens there?
So in ONAP, basically the office has sort of three main priorities. One of them is community engagement, going with community, hearing the conversations, what are some of the successes and some of the challenges happening around the country, and that also with our federal partners and our state and local health departments. The second is the national HIV strategy, making sure that we're working towards our plan, our strategy for this country. And the third is really looking at other things. As you know, HIV has some priority initiatives, but HIV does not and should not be in a silo, right? And so when we talk about HIV, we need to talk about housing, we need to talk about education, employment. And so the other sort of section of my work is looking at other things that are coming through the White House that have implications for people with HIV.
So how long has this office existed, and why is it so important that it exists and continues to exist?
So this office has been in existence for decades. The importance of having someone focused in on HIV in the administration at this level is really key. A lot of times our federal agencies and our partners are sort of working on their deliverables, of kind of looking down at some of the initiatives within, if it's NIH and research, if it's CDC and prevention programming. And so at this level, I'm able to see across those sort of different focus areas and kind of bridge the gap and sort of break down some of these unattended silos.
Yeah, you're that bridge. So you've been tasked with, I read, accelerating efforts to end the HIV epidemic and improve the quality of life for people like myself living with HIV. What gives you hope that we can achieve those UN targets by 2030?
We've seen some decreases from 2018, and so estimated in 2022, 31,800 new infections, which is a 12% decrease from 2018. We've also seen primarily a huge decrease, a reduction among young people aged 13 to 24. We saw a 30% reduction. And so all that is a testament to sort of the dedication of our community, as well as the access and innovation as relates to the opportunities around PrEP, pre-exposure prophylaxis, viral suppression, HIV testing, has all contributed to those improvements. And we also see, we've known that in the South, it has carried a big burden of the new HIV infections. But even in the South, we saw a 16% decrease in new infections. We have a lot more work to do, but we are having that momentum. And so it's really important to kind of lean into that momentum and make sure that all folks have access to the science that we know that's going to save lives.
Yeah, and what I love and what is reassuring for me, as I said, as someone who's living with HIV, is that you have skin in the game. You yourself are living with HIV. You were diagnosed about 5 years ago, I think. And what's interesting is in preparing for this interview and sort of looking at some of your interviews and stuff you've done, at that point when you were diagnosed, you'd been working in the HIV field for something like 16 years. What was that moment like for you to receive that diagnosis when you're sort of in the field of HIV?
Yeah, I've always said that working in HIV has always been a privilege, but there's also sort of a weight that comes with it, right? I think we oftentimes forget the human component of HIV. Even though it's within the acronym, we forget that there are people who are loving and living with HIV. And in this work, I had been over, as you mentioned, a decade, and I was off PrEP for personal reasons. And so I went back to get back on PrEP. And instead I got an HIV diagnosis. And I think for me, knowing that I was going to be fine, because I know science was there, was behind my back. I had access, thankfully, to health insurance, and I had the love and support of family. But even then, it was hard for me. I think it took me about 8 months to actually share with my family that I was living with HIV. Even though I got on medication right away, I got violently suppressed. There is that human component still that I mentioned, that stigma and discrimination, sometimes that we internalize. And so working in HIV, at that time I was working at CDC, and ironically, we were working on a stigma campaign. So I was going into the office, talking to my team, say, hey, how are we going to address this thing? How are we going to sort of battle HIV stigma? And then here I was sort of unable to share my diagnosis with others because of the fear of shame, because of the guilt. And so I think that's why in this work, we need to, yes, advance the science, but we can't advance the science without the human component. What does it mean to have this diagnosis for folks? I think for me, it's has given me a new sense of purpose when I'm in community talking to folks, sharing my diagnosis. And I know that many folks can't do that for various reasons, but visibility is really, really important, and making sure that we share our stories, and our stories are not always going to be colorful and beautiful, but there are stories of love and support, such as mine. And I think we also need to sort of shine some light on that and give hope to folks who are diagnosed with HIV. And those who are not, making sure that they have the information at their tips. So if they want to get on PrEP, that they have that information. And so I think it's really important to be sort of a messenger in this work, and as well as a practitioner.
Yeah, well, I mean, that's what we're all about here at Plus Life, and one of the reasons why we created it 5 years ago. You touched on there just for a moment, that internalized stigma. And I just think it's so important for people to hear, especially from people like yourself, Francisco, in a position like you have. As you just said, we're humanizing this virus, right? We're making it normal. How did you get yourself over that internalized stigma? Was there a moment where you were, or I know for me, I've been HIV positive for nearly 18 years. I still deal with the internalized stigma. That's how dangerous stigma is. And I don't think people quite realize that. We have all the external bits, but the damage it can do to a person diagnosed, especially when they're young, like I was, it takes a long time to undo it, or it's constantly a work in progress. Was there sort of a moment for you that you had some clarity on that, or is it a continuous journey for you too?
It's a continuous journey. I mean, I think every day when I take my medicine, I'm reminded that I need to take this medicine. Thankfully now, I don't feel the need that I have to disclose every time. You know what I mean? I think in this work, oftentimes you feel that you need to start with that. And so while I'm very sort of proud in all of my identities as being a queer, brown, HIV positive person in this space, I also am proud of all the accomplishments in the work that I've done. And so I think similarly, people who are diagnosed with HIV, yes, they have their diagnosis, but they also have all other elements of their lives. And I think it's really important to sort of find that balance of sort of standing firmly proud and sort of confident in sort of who you are and all your identities, but also know that those don't define you. You know, that we have other beautiful elements, and we must celebrate those as well. And I think, again, not everyone can do that, and I sort of recognize that it's a beautiful thing and a privilege to be able to sort of stand firmly and be at a stage and say, hey, I'm HIV positive. But I know there's a lot of people who are unable to do that, and I think that's where we need to sort of make sure that we have services for folks to have these conversations in safe spaces, either in digital platforms or support groups. And I think it's more than, again, just taking a pill. It's about that human component. How are you dealing with that? And I think you alluded to one really important thing is not just about living with HIV, it's thriving, right? How do you live and thrive and love with HIV? And so that quality of life is really, really important.
Absolutely. So how are you bringing this truth of yours and your lived experiences as a Latino person living with HIV specifically to this role that you do as the director of the White House's Office of National AIDS Policy?
I've organized myself in sort of the work in sort of in 3 sections. One of them is making sure that we revisit some of the policies that may be outdated. So understanding that a lot of the policies, be it employment policies, everything like clinical trial guidelines that sort of don't include people with HIV, making sure that we update these policies and that they're based on science, that we're modernizing some of these policies. And some of them are sort of in momentum already. We're already kind of going towards that change. I think the other thing that I'm trying to do is also accelerate, be very sort of equity forward. And so making sure that people that look like me, that have shared experiences, also have access to what I have in terms of to medication, but also access to all things to thrive in this country. And so that's education, that's employment. And so those are some of the things that I'm looking at. And the other thing in terms of the third section is just sort of how do we continue the momentum in this country with our HIV response And some of that is breaking down some of these silos, making sure that we're all kind of collaborating and coordinating across government, and also the silos that we see sometimes between communities, silos that we see sometimes between government and communities. And so how do we sort of address this collectively? It takes a whole of society, whole of government approach to end HIV. And so how do we do that collectively? And then also, how do we connect with our global partners? I think that's an area that we are starting to have more conversations of, oftentimes in this work, we're very insular. How do we look across the borders to see what other innovations are happening in other countries? And I think conferences like the International AIDS Conference are a good opportunity to sort of hear from other folks and then bring them back and test them here in country. And so those are some of the things that I'm doing, is using my not only work experience and expertise, but also my lived experience of knowing, like, what did I need when I was up and coming in this work to be able to be successful? And part of it is just having that opportunity and exposure, because the reason why I'm the director of ONAP now is because someone brought me to a meeting once and gave me that chance. And so I want to see how can we do that for the young generation.
Francisco Ruiz, you are the director of the White House's Office of National AIDS Policy. Thank you so much for making the time to chat with me today.
Thank you for having me.
That's going to do it for this episode of Plus Talk. Now, if you want more information, check out the website pluslifemedia.com. And remember, you can like, follow, share. We are across social media platforms at Plus Life Media. Until next time, be nice to one another. We'll see you soon. Bye-bye.